Good afternoon, Mr. Smith. My name is Hannah, and I'm going to be your nurse today. You have an order from your doctor to put in a nasogastric tube because you're not getting all the nutrients you need. So that's what we're going to do. If you could state your name and your birth date for me. All right, perfect. So I have all my materials ready for the procedure. I wash my hands and I'm going to put some gloves on. So I know this procedure tends to be very uncomfortable for patients, but I promise to make it as fast and as comfortable as I can for you. But at any moment during the procedure you feel as if you can't breathe or you feel like you need to throw up or in distress, please tell me and we will stop the procedure immediately and get with your doctor and do it at a better time. All right. First I'm going to ask you before I do anything, if you have any allergies to latex or anything like that I need to know. All right, perfect. All right, so I'm going to get started. All right, so before I start the procedure, I'm just going to let you know that I have this for you in case you feel sick during any time. I also have a cup of ice and water that I'm going to get you to sip on during part of the procedure just to help the tube go down more naturally. So the first thing I'm going to do is put this blanket on you just to keep your gown from getting anything on it. All right, next I'm going to measure the tube and I'm going to measure from the tip of your nose to your earlobe to your xiphoid process. And the purpose of this is just to make sure it goes into your stomach. Perfect. So I'm going to mark it with some tape. All right. Perfect. All right, and before I get started, can you tell me which side of the nose you breathe out best? All right, through your right side. Perfect. So what I'm going to get you to do is I'm going to get you to lean your head back. And then when you start to feel the tube in the back of your throat or you start to gag, go ahead and put your chin to your chest and start sipping on your water. So I'm going to put some lubricant on the tube just to make sure it just goes through, goes down a little bit smoother. All right, so let's get started. And just remember to tell me if you feel any distress and you think we need to stop. All right, head back. Here we go. Perfect. All right, go ahead and put your chin to your chest and sip on that water. Great, we're almost there. All right. So I'm just going to tape this down onto your nose just so we don't have to worry about it falling out. And you won't have to worry about it coming loose. So we don't have to re-put it back in there. Great, you did so great. All right, so we are going to send you off to x-ray just before we can hook up the feeding, just to make sure that it did go in your stomach. And so we can take the wire out to start the feeding. All right, back from x-ray, the x-ray looked perfect and confirmed that the tube was in the perfect spot, so we took the wire out and started the feeding. Okay, so you did great on your feeding and you're ready to take the tube out. So what I'm going to do is take the tape off and I'm going to get you to take a deep breath for me and I'm going to pull it out super smoothly. All right, deep breath. Good job, almost there. Perfect. So I'm going to roll this up. All right, good job, Mr. Smith. All right, so Mr. Smith handled the procedure perfectly. There was no complications. He felt no distress. His tube feeding was successful after the NG tube was confirmed placement, and he is great.